Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health, and I want to thank you for joining us. Today is May 10, 2022, and as always, this is your chance to get your COVID questions answered. We also talked quite a bit last Tuesday about mental health because it is Mental Health Awareness Month, and we've continued to get some questions there as well. So if you've got questions about what CDPH and our partners are doing in that space, we're happy to take those. The big news, of course, is that Chicago and Cook County did move into that medium COVID-19 level as defined by CDC on last Friday. So we'll review for everybody just what that means, what some of the recommendations are, and we've gotten a number of questions already about that. So if you've got those, go ahead and put them in. I'm going to pull up here our dashboard. chi.gov/COVID-dash. And if we take a look, you can see, actually, we'll do this in just a second. You can see that our cases continue to go up at 893 cases per day. That's up 24% from a week ago. Hospitalizations, though, look at that, how I'm going to blow this up so you can see it. You see that our hospitalizations are not following the same patterns that we've seen in other prior increases in cases. So this goes all the way back to the beginning of COVID. And you can see, first of all, we had the very big initial surge of hospitalizations. Then this is that first winter before vaccines were really available. Each of these two smaller surges, this is kind of how our cases are showing up. The ones in July, the ones kind of in spring and then in late fall. And then this very, very big spike. That was when Omicron hit us initially. So you see that hospitalizations here, even though cases are turning up similar to how they did last spring and last fall, hospitalizations are very low compared to what we've seen previously. And that is primarily because of vaccination and boosting. It is also, to an extent, a result of where people have recently had COVID and recovered. They continue to have some pretty good protection against these subvariants of Omicron. Deaths, you can see, remain low. Our average daily rate is 0 per 100,000. Even at 0.43 daily average, that's something between 1 and 3 Chicagoans per week dying of COVID. And if you zoom in on that, you see this too, just a very, very different pattern than what we've seen previously. If you look back, at the beginning, this is 50-something Chicagoans dying every single day of COVID, and to go from 50-something Chicagoans every day down to this point where most days there are no Chicagoans dying with COVID. If COVID had shown up the way it is behaving right now, we would not have had all the major disruption. That said, cases are on the rise, and that's what has pushed us into that medium risk per CDC. You can see our positivity is at 4.9%, which is getting closer to that 5%. I do think we'll be going over it. And that, again, just is a signal to us that there is a lot of COVID around. We're doing enough testing to be able to capture it, but really want to encourage people, if you have symptoms, take a test. It is COVID right now until proven otherwise. If you're going to be gathering in a large group, especially if masks might be off, it's a good idea to just take a home test, especially if there are people who are going to be at higher risk, immune compromised, et cetera, in that group. So although the severe outcomes continue to look really quite good, the risk of COVID and just being out and about and people having it is higher at the moment. So let me show you some additional data here. So first of all, I want to wish all of our mothers a happy Mother's Day. I was able to see my own mother on Mother's Day, which was good. If you go to onechifam.org, that is our one-stop shop for supporting families. There's a lot of information there about raising kids in Chicago, and I would strongly encourage anybody who's got kids, whether moms or not, to take a look at that and give feedback if you have suggestions. Lots in there for support and resources for families. If we look at COVID, there's a few things to note. Internationally, you can see that the parts of the world that are still surging the most are Australia, New Zealand, parts of Asia, and then parts of Europe in that dark purple. And these are really very high, over 70 cases per 100,000 in the past week, and average daily cases over 100,000, and 4, 5, 6 times what we're seeing here right now. But even there, pretty low rates of hospitalization and death, mostly because of vaccine. We're also continuing to see vaccinations increase around the world, 11.6 billion vaccine doses administered, which is remarkable. And if we look in the U.S., you can see that Illinois is seeing, and really the Midwest there, is seeing some more increase. Nationally, across the whole country, we're at 22 cases per 100,000 being formally diagnosed in laboratories. Illinois is at 41 right now as a state, and Chicago is at 33. So all of this, again, much, much lower than what is being seen in much of the world, but nevertheless, it is on the increase, and you can see that the Northeast remains the area with the most cases being diagnosed, also the most testing happening. And we got a question in about, have we hit 1 million deaths? And it depends a little bit how you're counting. You can see here 996,612 formally have kind of come in through CDC, but basically right now, depending on the day, yes, we have hit approximately 1 million COVID deaths in the United States, which is a really sad benchmark to have hit there. I actually co-authored an article about this with some other big cities health coalition leaders as we pass that and think about what we do differently to be prepared as a country for responding to potential pandemics in the future. So we are now at this medium community level. Just as a reminder for everybody, we can be low, medium, or high. The goal is to simplify this. And whereas at low, the guidance is masks are optional, but that certainly be kind to those who are choosing to wear a mask, and certain people will, especially if they're unvaccinated. As we move to medium, we do strongly recommend, again, putting those masks on indoors. When we get back down to low, that would go back to masks being optional. If we got up to high, that is when we would be needing to potentially require indoor masking. And so, we are seeing some impact on our health system. We're seeing some more people who are sick. And so these are kind of the 3 versions. On the left are the masks optional when we're in green and at low risk. In the middle there at medium COVID-19 level is when masks are strongly recommended. I am back to wearing mine if I am out and about, and especially if I'm in settings where I don't know everybody or it's a crowd. Remember, one of the reasons we put masks on is because you can spread COVID for 2 days before symptoms develop. And so having the masks on does help protect others as well as yourself. And on the right there is if we were to move to that high level is when we would be moving more toward mask requirements. And if we look at the US, you see that really most of the orange is in the Northeast there. And to get to that high level, you need both, and we'll show you the data on this, but it's both about having higher case rates and having higher hospitalization rates and a higher percentage of beds taken up with COVID patients. So in Illinois, you can see Northeast Illinois in yellow here. Not only Cook, but really most of the surrounding counties are at that medium risk, as well as a cluster in central Illinois. And so 12.3% of the counties in the U.S. are now either medium or high. And if you are traveling, we encourage you to take a look at this map. And if you're in medium risk, we recommend wearing a mask in indoor public places if you are traveling to one of those counties at medium risk. And in high risk, definitely wear the mask in indoor public places. And if the county you're wanting to go to is in red, in high risk, if you are not up to date with COVID vaccines, really you should avoid traveling. And if you do travel, you should be staying home and quarantining, taking COVID tests, etc. So luckily not much of the country there right now, but if you were planning to upstate New York right now, that I would have some concern about that. You should be extra careful if that's where you're heading. So let's look at the actual numbers here. Cheryl S. on Facebook, for example, was asking, what is the community level based off of? Positive tests, hospitalizations. So this is what it's based off of. There are 3 metrics that are followed. The first one is about new cases per 100,000 people in the last 7 days. The goal there is to be less than 200. Chicago right now is at 231, and all of Cook County, including suburban Cook, is at 259. So we have passed the threshold to move into medium risk just based on cases. There's a lot more COVID around. The other 2 metrics are about how hard is COVID hitting our health system. And it's really when we start to see people get more seriously ill or we start threatening the healthcare system that we need to take action, because like in a more of a legal way, because the risk of not being able to treat people for non-COVID issues, we can't have that threatened. And we've seen that it is possible with COVID. So if we look at that, let's just talk about those 2 metrics. In the middle there is just about how many new COVID admissions are we seeing per 100,000 population. Again, a 7-day total. The goal is to be less than 10 here. Chicago is at 3.5, so there's 3 to 4 of every 100,000 Chicagoans getting admitted per week. It's really quite low. All of Cook County, sort of including suburban Cook, and actually the CDC uses an even larger area when they're looking at health care uptake. So it's not just Cook, it's all of it's some of the counties around us. That is higher, that is up to 6.9. But then the proportion of staffed inpatient beds occupied by COVID patients in the last 7 days. Our goal is to have less than 10% of our hospital beds taken up by patients with COVID. And in Chicago, less than 3%, 2.9% of our beds are taken up by COVID patients. And in all of Cook County, it's just at 2.2%. So that looks good. The only one I'm watching closely is that sort of new COVID admissions, and hoping that will stay under 10. So that's the one. If you're interested, we'll be updating this and you can follow along. It really has been a gradual rise in COVID cases. A lot of you asking what's driving this. And I would again encourage you just to look at how different the slope of that case counts looks like as compared to sort of December, January, when we were seeing that very dramatic increase. It is looking much more similar to the small little wavelets, if you will, that we saw, for example, with Alpha. And we are seeing a lot of first-time and very mild COVID infections right now. Few hospitalizations or deaths, but a lot of breakthroughs. And that's one of the reasons we strongly encourage more testing and just an increased level of awareness. Even if you have what feel like very mild symptoms, please take tests. They're widely available, and the at-home tests are just fine. Here's just what our hospitalization data does look like. Our all-time peak was just earlier this year, January 4, where we had over 300 Chicagoans newly hospitalized with COVID in a single day. And right now we're averaging across the whole city 14 Chicagoans each day, which there are a lot of other things that more people that have, many more people get hospitalized with cardiac issues, for example. So we want to keep that low. And I did want to highlight, we got some questions about, it seems like these vaccines aren't working anyway. Why do you keep pushing them? So I thought I would show you the data on this. And this is available as one of the pull downs on our dashboard. So even in the past 2 months, when COVID has been in quite good control, Chicago's age-adjusted COVID-19 hospitalization rates have been almost twice as high in unvaccinated Chicagoans compared to those who are vaccinated. And if you look at this this graph here, it shows you in red, these are just Chicagoans. If they have not been vaccinated, are they getting hospitalized for COVID? And this is regardless of whether they've had COVID before. This is regardless of anything. It's just vaccinated or not. And then in light blue, we see the vaccinated but not boosted. And then in dark blue, we see the vaccinated and boosted. And so at the peak of the Omicron surge, when things were really bad, people were 15 times as likely to get hospitalized right here in Chicago with COVID if they were unvaccinated. But you can see that getting boosted mattered, especially during Omicron. And so if you're not up to date with your boosters, please do that. But even in these past couple of months, people who are unvaccinated, twice as likely to get hospitalized. And again, this is why we continue to focus on vaccination. It is the most important thing that helps limit your individual risk, the risk to your contacts, risk to the city. And same thing on deaths here. As I said, really at historic lows, the lowest number of Chicagoans dying with COVID-19 right now than at any point in the pandemic. And if we look at the data on vaccines and boosters, that same thing. The red shows you Chicagoans who are unvaccinated and have died from COVID. The light blue shows you Chicagoans who are vaccinated but not boosted. And the dark blue shows you vaccinated and boosted. And at the peak of the Omicron surge for this one, age-adjusted COVID death rates for unvaccinated Chicagoans were 30 times higher. So if you were unvaccinated, you were 30 times more likely to die of COVID than folks who were vaccinated and boosted. But even in these last couple of months, the Chicago residents have been more than 3 times as likely to die if they're unvaccinated as compared to those who are up to date. And you can see, if you look at the very right side of that graph, that some of the increase that we are seeing right now, again, although it's low in death rates, is in that red line. It's in Chicagoans who are unvaccinated. So if you know somebody still who is unvaccinated, this is the kind of data that I look at when it's why I feel so strongly about continuing to encourage vaccination and why we continue to invest a lot in it, because it literally saves lives. We've also been getting lots of questions about variants. So here's what is going on. Everything is still Omicron, okay? Everything is still Omicron. You can see Delta is at 0%. We've not seen a very, very different variant emerge variant of concern emerge at this point. But we have seen, even within Omicron, continued evolution of Omicron subvariants, each of which is more infectious, more contagious than the last. And so if you look at that purple there, that's this, each line is a week. So this basically takes us from February through to the present. And you can see back in early February, everything was sort of the original, that original Omicron, B.1.1. And then as BA2 came in, you see it really took over and became the predominant strain. And then now BA2.1.2.1 is coming in and being the strain. The numbers don't matter as much as that pattern. And to me, when we see patterns like this is when we are going to continue to see these relatively controlled sort of smaller waves. Because if somebody was infected with the original Omicron or BA2, this sort of next subvariant, they have relative protection against it, over 90% based on everything we're seeing at this point. But it is even more contagious. So the other reason for putting the masks on again right now is that even this subvariant is itself more contagious than the 2 prior variants of Omicron. And so everything that we can do to help decrease that spread helps us protect people who are at higher risk for severe outcomes, but it also helps us keep these waves small. So the concern and the big question is if and when we might have a variant emerge that is not Omicron, is not a subvariant, but we haven't seen signs of that yet. And if you look at this across the US, this is where, for example, why is the Northeast surging a little bit? Well, if you look, that dark red, that's that newest subvariant of Omicron, is now the majority out there. Whereas you can see where we are, it's still, it's about a third of what we're seeing. And as these more contagious variants come through, that's where you see some surge. And this is a pattern that we've been seeing sort of over and over again. And so, unfortunately, I do think we will continue to see this gradual increase of cases, probably for at least a few weeks, while we see that subvariant outcompete the Omicron BA2. So the other reason to sort of really recommend the indoor masking right now is that not only are there more people with COVID around, but there are more people with the more infectious version of Omicron. And we have seen that, particularly in the Northeast, it's a little bit ahead of us, if you will, in this wave, that it's likely to have even more cases before we see it turn around. And the last thing we want to do is have people, really see the hospitalization numbers going up significantly. So that's why getting up to date with your vaccines is critical. This is what our vaccination rates look like in Chicago by community area. We still have a few areas that are under 50% vaccinated, and those are the areas that we worry about the most. We got a question in about People's Response Network said on Twitter, surely racial disparities skew the case numbers. Black Chicagoans can't have fewer cases and lower positivity than whites. We're least vaxxed, most hospitalized and dying. But actually, where you're looking at cases, right now we are seeing the most cases not in Black Chicagoans. We're seeing more cases in white Chicagoans and suburban Chicagoans because we're seeing a lot of first-time COVID, and Black Chicago got hit really hard during that initial Omicron wave. So being unvaccinated remains the highest risk factor for being hospitalized or dying from COVID, but that initial Omicron wave continues to provide some level of protection. It's not the way you want to get that protection given how hard that wave hit unvaccinated Black Chicagoans, but nevertheless, it's part of why we're now seeing a lot of COVID show up in communities that were not hit as early on. So I hope that helps explain that. Here's what our vaccination rates look like by age. Still, just over half of our 5 to 11-year-olds have had a first dose, and still only 71% of those over 80, and that's just what kills me, because when people over 80 are not vaccinated and they get COVID, they are just at dramatically higher risk of hospitalization or death. So we're doing, our call center right now is doing we're calling out to tens of thousands of Chicagoans who are older and not up to date with their vaccines. Really also to anybody who is getting COVID, we're calling to make sure they know how to access early treatment, because we just want people to, if they get COVID, to have a mild case, to not get hospitalized, to not die. And this is what our vaccination by race ethnicity looks like. Still seeing lagging vaccination in Black and Black non-Latinx Chicagoans. And we were at a point where Latinx Chicagoans were more likely to have a first dose than white Chicagoans. And just in the past few weeks, we've actually seen some white non-Latinx Chicagoans choose to get vaccinated for the first time. But nevertheless, the group that is most likely to be vaccinated remains Asian non-Latinx Chicagoans. And this is all ages. So you couldn't be at 100% here because the youngest children, of course, have still not had the opportunity. But this is what that data looks like. We are pleased that Black Chicagoans are the most likely to be choosing to get vaccinated newly right now. So even though this has been dropping off, there's a few hundred people getting that first dose of a COVID vaccine in Chicago every single day. Around 59 Black Chicagoans in purple there on top, and another 54 completing the vaccine series every single day. So those are low numbers, certainly compared to the thousands at the beginning, but I will take 50 or 60 people every day making that decision among Black Chicagoans in particular, and a few hundred every day. And then, of course, many more getting boosted. And so just as a reminder, we want you to stay up to date, wear the face mask, get tested if you have symptoms. You got to keep following all isolation and quarantine guidance. And then if you're at high risk, be talking about other precautions you may need to take. We do have COVID tests available, those at-home kits. They are widely covered by insurance. If you don't have insurance, we have others available. Healthcare providers have them, community health centers, pharmacies. We have pediatric COVID testing sites. We have community-based testing available. Chai.gov/COVID test is your place to go. If people are calling our call line and really not able to find tests, we have ways to make sure people can get connected. We've actually distributed about 40,000 tests free of charge in the last month. Those are meant for people who are uninsured or otherwise unable to access it, and we work with community partners around that. But we continue to really pay attention to the data, see if there are places where we're not seeing the testing rates that we need, and then working with community community groups and others. So please, please take your tests, order your free ones from the federal government. Make sure you have them on hand, and reach out, including to our call line if you're really having trouble getting a test. And just a reminder, because people were asking again about what's happening again with timelines, nothing has changed related to the timing for isolation or quarantine. So regardless of your vaccination status, if you catch COVID-19, you need to stay home for 5 days. If your symptoms are resolving or gone by day 5, which they are for many people right now, you can leave your house, but you need to continue to mask. That is a requirement while around others for days 6 through 10. So I hope that that helps sort of clarify it. And quarantine, if you're a close contact and not up to date with your vaccine, is similar. Staying home those first 5 days, masking days 6 through 10. And also people still asking about when should they get booster doses, etc. Everyone over the age of 12, to be up to date, should have a booster shot if it's been 5 months. If it's been 4 months, actually, since your initial Pfizer and Moderna series, or 2 months after your J&J vaccination. And the first booster dose 5 months after, the second booster dose 4 months after. And the reason that those are slightly different is because that second booster dose is really just for the specific group that is at highest risk. So that's individuals over 12 who are moderately or severely immunocompromised. That doesn't mean someone who just has hypertension, for example. It's really about being moderately or severely immunocompromised, and a doctor recommended it. But anybody over the age of 50 can choose to get a second mRNA booster, meaning Pfizer or Moderna, and we really encourage that if you're over 65, if you're over 50 with an underlying condition, and just as we move into medium risk, if you're over 50 generally, I think it's a good idea to do. So let us know if you have additional questions there, but still, most Chicagoans who are due for a first booster have not had one. And that's especially true for younger Chicagoans. So we continue to really put a lot of resources into our Protect Chicago at Home program. We're going strong. Anyone over the age of 5 can get a COVID-19 vaccine at home, no questions asked, in the city of Chicago, no cost. We do pediatric, we do adult, and we do boosters. Yes, we will bring a first booster. Yes, we will bring a second booster. Vaccinated up to 10 people at a time, and we've got appointments Saturdays, Sundays, Mondays, and Tuesdays from 8 a.m. all the way to 6:30 p.m. Certain zip codes, there are also $50 gift cards if people are getting their first or second vaccine. And you can go to chicago.gov/at-home to make an appointment or give us a call. And that number always is 312-746-4835. So we're going to go ahead and end the slideshow. And I just have to, we're having a little bit of a technical thing here, so I can make sure we can pull up your questions. In the meantime, perfect, thank you. Tom Seifert on Facebook is asking, who gives the authority to the Chicago Department of Public Health to mandate masks indoors? So the Communicable Disease Code, both at the state level and at the city level, clearly gives the authority to the Chicago Department of Public Health to impose, if there needs to be things put in place to protect the public's health. So I would refer you there. There's some information on the website. But this is actually enshrined into code and law going back hundreds of years. So if you want to take a look at that, you are welcome to. Jess P. on Twitter. There's lots on the prevalence of the different Omicron or BA strains, but are there differences in how contagious and severe they are? Yes. So the main difference that we're seeing is in the contagiousness or the infectiousness. And the reason we see the virus outcompete, the reason I stayed on that picture for a while to kind of show you these waves that are coming through is each of those subvariants is a little bit more contagious or infectious, which means it spreads better. It outcompetes the earlier version of Omicron. But we're not seeing changes in severity, in that still any version of Omicron where somebody has been infected seems to give at least a 90% protection against sort of reinfection, at least in the short term, with these subvariants. So one of the reasons that I do not have concern that any of these subvariants will turn into the really huge out of control spike, which is when we have to take some of those greater measures, is because we're not seeing very many people who got infected in December and January now getting reinfected with those subvariants. Of course, if we get a new variant of concern, what we know is that prior protection is not as good. And one of the most important reasons to get vaccinated is there does seem to be some more sort of cross-strain protection there, especially against severe outcomes. Afrobella on Twitter, what is your advice to the public about dining at restaurants or bars right now? So my general advice to the public about dining at restaurants or bars right now is that people can dine at restaurants or bars. I continue to go out myself, but I am being more cautious. I, for example, would have my mask on when I'm out and about, until I'm sort of seated. And I am careful, honestly, especially at this medium level, about the people who I am dining with. Those are the people, of course, who you're going to have that more than 15 minutes of close contact without masks. I'll be honest with you, I have had 2 known what I would consider close exposures for COVID this whole time. One was eating in a restaurant with a friend. One was seated at a bar with a friend. In both cases, my friends were not symptomatic, fully vaccinated and boosted, as am I. But those are the 2, in my own personal life, the 2 settings that I was at highest risk of getting COVID. Neither time did I develop COVID, but after that exposure, I was very careful to test. Obviously, I also test if I have any symptoms, and if somebody is really higher risk for a severe COVID outcome, especially if they're not vaccinated, there will be people who might say, right now is not the time to go out and to be dining. But I do think it is fine for people to be going to work, to be going to school, to be living our lives. If and when we got to a high risk, that again would be when we would have to be thinking a little bit more seriously. Because remember, that's not just about cases, that's about severe outcomes. It's that COVID itself is showing up in a way that is putting a lot of people in the hospital, that's really straining our healthcare system. And so if we get to high, that's when I think at both an individual level and a city level, we have to think a little bit more because we cannot, Omicron surge to me was so depressing. I have to just tell you, seeing more Chicagoans hospitalized than at any prior point in COVID, and most of those folks being unvaccinated, just hurt my heart. And seeing the way our hospitals got slammed, knowing that so many of those hospitalizations were preventable, and seeing all of these deaths really was worrisome to me. And if you remember, we put in the vaccine requirement for high-risk settings, which included restaurants and bars, for that reason, because folks who are unvaccinated in these higher risk settings at a time when the risk is high, not medium, high, it's about protecting our health system at that point. So that's what I would say. I continue to go out, but I am being more careful with doing some more testing of myself. I'm being a little more careful with the close contacts, making sure people are vaccinated or boosted, which is the most important thing. But I want people to advise. The other thing is, boy, is this beautiful spring weather, and we can eat outside, right? Moving a lot of these activities that we love and that I want people to do. I'm excited about it finally being real spring weather and summer. Being outside is one of the easiest things you can do to cut the risk entirely for COVID. And so, you know, if I'm going to a bar or restaurant right now, I'm going to see if there's an outdoor space, right? Because that just takes the risk down and the worry down for everybody. So it's all about layers. It's never going to be the same answer for everybody. But by and large, my advice is that you can continue doing the things that you love, that make our city great, that are good for your mental health, just with some extra attention to the other precautions that can come around that. Okay. Let's see, lots of questions. So Olivia Carter on Facebook is saying sanitizing correctly is the key to control the spread of germs. How well is it implemented and supervised, especially at schools? So I will say sanitizing correctly is certainly the key to controlling many germs, in that it is at base important to make sure that especially what we call high touch surfaces that many people touch, are getting cleaned well. But I will say that if this is about COVID in particular, the biggest risk is exposure to other, close extended exposure to living, breathing humans, and that has been true all along. So I think at schools, we've done a lot of work to really understand the risk of COVID transmission. And we don't see a higher risk of COVID transmission in schools than we do in the general community. We see what is happening in the community often drive what is happening in schools, not the other way around. And so, yes, it's important to have good cleaning in place, but for the most part, it really, if you're keeping up with the good routine cleaning, which is important, you don't need, especially, for COVID, to be doing anything specifically different. It's more important that you're thinking about the environments, the airflow, the ventilation, which have also had attention, especially in schools. So I would say, I've had somebody on here even talking about what are the cleaning protocols at different schools, and I think we've never paid as much attention to issues like ventilation and sanitation as we have in these last couple of years, and hand washing, right? Like hand washing is at the base of sort of what can help prevent the spread of all kinds of germs. So that's, I would say that I don't have a major concern, certainly at any systems level, about a lack of attention to that. Okay. So there's sort of a long question here from Carrie Beerus Cook on Facebook. Let me see if I can kind of read the whole thing and sums it up. So Carrie is asking about, can you talk about who is considered a close contact in CPS classrooms? Why wouldn't a child be considered a contact if they're in a classroom with a COVID positive classmate? I don't understand why children who are wearing masks and are vaccinated are not considered close contacts. Vaccines work. We're happy to be protected from hospitalization and death. They don't always prevent transmission. We wouldn't want to spread COVID to others. Can you explain the reasoning behind not telling families when their child has been in contact with a COVID positive classmate? Okay, so there's a whole lot in there. Let me sort of break down a few pieces of that question and tell you how we think about COVID in schools. And remember, we give the same guidance to all schools. This is not CPS specific. So first of all, to the last part of your question, you should be getting a notification if there is a COVID positive person, classmate, full stop. You should know that. And we have encouraged and worked hard with all of our schools to make sure that that notification is there and is automatic. It doesn't, I'm not talking about if your child is a close contact or not. I'm talking about just broadly. We want people to be aware and to be, we always want you monitoring for symptoms in your kids or in family, et cetera, but there should be that communication. Now, the question around quarantine is often where the close contact conversation comes in. And this is where when kids or adults are vaccinated and up to date with vaccines, the CDC's recommendation is that they do not need to quarantine, given that their risk of developing COVID is less. It is not zero, that is true, but where we are balancing the risks and the benefits, especially for kids, and we've seen the really bad indirect effects of most kids don't do very well with remote learning, honestly. There are certain kids who you've got to make sure you have it if they're, have the really severe underlying conditions, et cetera. But by and large, a child who is for the most part healthy is unlikely to get seriously ill with COVID. And so if they're vaccinated, we do not have a requirement for them to quarantine. And so if you want your child's education to not be disrupted, if you want to help with that, ensuring that kids are vaccinated is the most important thing. But as we would like to see actually even less quarantine, frankly. Isolation, remember, is when a kid has COVID. If a kid has COVID, they need to isolate full stop for at least 5 days, and they have to wear a mask for days 6 through 10 if they come back to school. But this is where implementing programs like Test to Stay is something that CDPH strongly recommends. We've been pleased to see many schools putting this in place, and my guess is it will probably be more, we'll see even more schools do this as routine. And what that means is, especially now that there are more rapid tests available, that if there is someone in the classroom who had COVID, you actually just administer, or offer home tests, or, there's different ways of doing it. We see cities across the country, across Illinois, doing this in different ways. We see schools in Illinois doing this in different ways. But the idea is you actually do more testing, and you do that on a number of different days. And as long as the testing stays negative, the children are able to stay in school. So it's a good way to balance sort of catching, risk against the indirect effect of sort of being out. So if we sum all of this up, first of all, please make sure your kids are vaccinated because, it's the most important thing for protecting against severe illness, but it also cuts the risk of transmission. It also makes it less likely that your child would need to quarantine. If they got COVID, they would still need to isolate at home, but they would not need to stay home or be separated if they are a close contact of a child. You should be getting notification if a child in your class has COVID, if they have been in school during the time when they could have potentially spread it. And we're seeing a lot more COVID, of course, in schools right now because we're seeing a lot more COVID in the community. Most of those cases are not linked at school. Most of them are linked through family contacts, also a lot of out-of-school activities, which, we understand and we're glad are coming back at some level, but those remain higher risk. And even where we're seeing connections and potential spread at schools, it's much more likely to be the school dance, the school camping trip, as opposed to sort of the regular attendance of school. And some of that is that the schools have done a lot around, ventilation. They've done a lot around protocols. And so this is always a balancing here. But we have very strong screening testing also in a lot of schools, which adds another layer of safety that many, many schools across the country are no longer doing. So I hope that helps you kind of understand a little bit where this is coming from. If your kids are vaccinated, it helps them not need to quarantine. We are really encouraging schools to use group contact tracing, group testing, and more of the test to stay protocols, and where schools and even some of the early childhood education settings have been implementing that. It's generally been going very well, and so I think it's a good way, and we've been encouraged to see more and more schools taking that up. All right, Susan Villanosa from Facebook. If exposed and fully vaccinated, also isolate for 5 days and mask for 5 more days? Okay, so let me just be super clear on this. So if you have been exposed and you are fully vaccinated and up to date with your vaccines, meaning you're vaccinated and boosted, like I am, when I had that exposure that I was telling you about, where, I went to dinner with somebody else who was fully vaccinated and boosted, and we were sitting across the table from each other, and then, the next day she found out, she got some symptoms and found out she had COVID. Because I am fully up to date with my vaccines, I do not need to stay home, but I was very, very careful to mask for that full 10 days. If I were not up to date with my vaccines, meaning I wasn't boosted, I'd never been vaccinated, I would stay home, isolate, but really the word we use is quarantine if you don't have symptoms, for 5 days, and then go out and mask for the 5 days after that. And so if you are not up to date with your vaccines, you would need to stay home for those 5 days and then wear the mask. But it's really that 10-day window after exposure that we're concerned about. Most of the time, we see it show up in the first 5 days. That's part of why, as COVID, the virus has evolved, the time, sort of the lag between when somebody is exposed to when they develop symptoms or test positive has gotten shorter and shorter. That's one of the things we've changed. So one of the reasons why we've gone from needing sort of, remember at the beginning, 2 years ago, it was 14 days because we saw people, as late as 11, 12, 13 days, they'd have the exposure there. It took that long to get to the point where symptoms are developing and they're testing positive. That's not what we're seeing now. Almost all the time, it is in those first 5 days. But there are still some people in that 6 to 10 day that can turn positive. And so we've tried to, again, adapt guidance based on how the virus has changed while still protecting public health and balancing that need to protect public health against the need to recognize that we're not going to eradicate COVID, and you want to balance, making sure that at the highest risk times, whether it's when the city is at a high level, whether it's when someone has had an individual high risk exposure, that is the time at which they are being more careful about not further spreading COVID. And CDC actually has a really nice quarantine and isolation calculator. It's an interactive tool. We link to it on the CDPH website, and you can literally put in your details. Like, this is the day I was exposed, this is my vaccination status, and it will tell you this is how long you should quarantine, this is how long you should isolate. So I encourage you, if you would like some guidance around specific dates, etc., you can use that tool. You can also call our hotline always, and people are happy to help you talk through that, because I know it can be confusing. All right, so a number of questions here about sort of monitoring cases. So there's a number of these. So let me just read a few of them and then I'll address them together. Jason Guthars from Twitter says, why has Chi Public Health spent the last 6 weeks denying uncontrolled COVID-19 spread in Chicago? Why was 200 cases a day once a threshold? But there have been changes with a less contagious variant, but no mandate now with BA2 and 900 a day. Elin Pennebaker Hill on Facebook says, can you speak to the ascertainment bias for daily cases? Love that. You've been paying attention to some of the technical language there. If folks don't know what that means, we'll talk about it. Andrew Herrera from Twitter says, I've been wondering how accurate these numbers are, since it feels like everyone I know just got COVID, but all of them tested at home and self-isolated on their own. I imagine this is increasingly common and could lead to significant undercounts. So let's take all three of those together. So first of all, Elin Pennebaker Hill is talking about this ascertainment bias for daily cases. And the ascertainment bias is we never, ever, ever since the beginning of COVID have we counted every COVID case. If people have it in their mind that we count and report every COVID case, get that out of your mind right now, because it has never, ever been true. We count every COVID case that is tested and has a positive result. And that has always been true. But the ascertainment bias means how many more cases are there out there than what you are ascertaining. And to really understand that ascertainment bias, you have to understand testing patterns, and you have to understand the outcomes that are not affected by testing patterns. So first of all, there are estimates that epidemiologists across the country use based on testing rates, et cetera, how many more cases are there than what formally show up in numbers. And those numbers have been different at different points, because at the beginning, remember in the beginning, there wasn't testing available, right? There was so much more COVID than was possibly ever counted. However, anybody who was sick enough to end up in the hospital or who died, those people get tested. And so what we do actually is look at things like hospitalization and death rates, especially hospitalization rates, because those have been settings with much more consistent access to testing, and we're able to understand how many people, are developing severe illness, but also what the undercounts are based on what hospitalizations look like. So if you look back at our numbers, we know the ascertainment bias was much worse at the beginning of COVID because very little testing was going on. This is also where positivity comes in. Positivity for me is the way we say, how much COVID are we missing, if you will? And so the thing is, we test a lot here in Chicago. The fact that our positivity is still less than 5% is pretty remarkable because across a lot of the country, it's well over 10, 15, 20%. And around the world, it's 30%, 40%, 50%. And that's because a lot more people are doing at-home tests. At-home tests, I love at-home tests. In terms of controlling from a public health perspective, an at-home test, it's what I use. They're very, especially if they're positive, they're positive. Like, you trust them. I have COVID, especially if you have symptoms. If they're negative, you still have to, continue wearing the mask if you've had the high-risk exposure. But they're very, very good. They're highly accessible, and you can act on it right away. Please do not worry that us not counting every rapid test in some way means we don't have a sense of what is happening with COVID. We do. But the individual number of cases doesn't mean the same thing that it did back 2 years ago when we were testing so little, right? Even if you go back to the first summer of COVID, like through that whole first surge, the last time we had really low numbers, we were only testing 4,000, 5,000 people a day. That's before there were at-home tests. We're now testing more than 20,000 people a day. And so I would expect to be seeing 4 times, when we were at 200 at a time when we were testing 4,000 a day in the formal system is similar to where we're now at 800 testing 20,000 a day, right? And so please rest assured, we follow all kinds of metrics and we were really gave some guidance. And as the CDC was thinking about how do we do a better job of helping people understand their own risk with this low, medium, and high, it's about a combination of cases. And when you hit that threshold of 200 cases per 100,000 over the last 7 days, when you hit that threshold, it means there is a lot more COVID around. It's just a binary, lower, higher. We're at higher, there's more COVID. But then the second piece of that is how is it showing up in terms of severe outcomes? And we're following genomics, we're following wastewater, we're following so many other ways of really understanding how COVID is showing up. And so I really want you to continue using those at-home tests and trust that our ascertainment bias at this point is somewhere in the 3 to 5 range. We run these estimates, and maybe I'll do this for next week if people are interested. Across the country, there are estimates that the ascertainment bias is somewhere between usually 3 to 5, 5 to 7, 7 to 9, 10 to 12. We test a lot here, so ours is considered to be really at the lower range. So actually, yes, there are way more people with COVID right now, but the exact number has always had ascertainment bias in it. So I hope that helps you kind of understand that context. And Jason, to your question, we have not had uncontrolled COVID spread for the last 6 weeks, just to be clear. We've had increasing spread. I consider uncontrolled spread when we're seeing those huge, the huge spikes, like what we've seen 3 times here. We're seeing increases in cases, certainly, but not uncontrolled and not turning into those numbers. The shift to medium is our yellow light in some ways, saying, yeah, risk is getting higher. We should all be being, wearing the masks again, being somewhat more careful. But the reason that those thresholds change is because A, the virus change, B, the testing patterns change, and C, our understanding of whether and how we can keep COVID from turning up and, in the way that it did initially, people hospitalized and dying, means that you can tolerate, as a city, more formally diagnosed cases than you could previously. And really protecting the health system is, at the end of the day, the thing that we have the most concern about. We are actually being more conservative than a lot of places when we say if we got to high, we would be probably putting those mask mandates back on. But I do think it's appropriate if you're threatening the healthcare system. All right. Okay, so actually here's a quick follow-up from Carrie Beerus Cook on Facebook, who says, I'm not arguing about quarantine procedures, but communication. I think my school is under the impression they can't tell us unless it's a close contact. And so, there's that there have been vague emails saying someone in the building, that there's a difference in the classroom. I agree with that. And I think, we can certainly, as we're talking with the schools, do some reinforcement. I know we've been encouraging schools to do similar to what CDPH does, really be thinking about some of the automated notifications that are in place. So, when we learn about a case in Chicago, we right away, there's some automated notifications that are going out to whatever, phone number you gave when you got your lab test, for example. So we know that people are getting sort of information. Like, we've thought a lot about how to improve that communication in a way that is relatively routine and automated. And I think there's value in building that, for other reasons too, not just COVID in school systems. So yeah, thanks for raising that. I think communication always is challenging. People often are confused about isolation versus quarantine versus risk. But I know that there's been work to continue to have that be standard. And I think, continuing to just advocate at individual school levels around some of that is good. All right. All right, what else do we have here? Coops from Twitter. What is Chicago doing to assist the uninsured with vaccination and treatment now that the funds are not available from the federal government? So we've been very, very clear. Oh, we're just about at time. I hadn't realized. Anybody who is uninsured will continue to be able to get vaccinations in the city of Chicago, full stop. We have been careful with our funding from the federal government. For example, one of the reasons that we backed off a little bit on providing the incentives, the financial incentives for people getting their first and second doses of vaccine, and we limited that only to certain zip codes, is to save some funds, to make sure that we can continue to offer vaccinations to all. But I can guarantee you that there is not a world in which CDPH would ever not have COVID vaccines be freely available to all, because they are so critical to preventing severe illness, protecting Chicago, and we do not want any barriers for there to be. So yeah, it's expensive for us to run the at-home program to anybody. It's expensive for us to continue to offer some of these options, but public health is all about prevention, and it is the most important thing for prevention. And it's way cheaper to pay for somebody's vaccine administration than it is to, pay for their hospitalization, for goodness sakes. Treatment is a little trickier. And this is where we've been working very hard to make sure that, for example, the federally qualified health centers, which all treat people by definition who are uninsured, have access to, know how to get people those treatments. We've also been really increasing awareness of them, calling folks, helping sort of get through barriers where there are. Cook County Health and Hospital Systems is really working and doing some creative thinking around, could there be some more telemedicine for people who may be uninsured, and using that system around accessing treatment. So there's a lot happening there, but we, first and foremost are all about decreasing barriers to appropriate COVID prevention and care, and we're super committed to that. There's a lot of things I would pull back on way before I would think about putting barriers in place, especially for something like vaccination. All right, I think we are going to have to call it a day just because we're at time. Let me see what we missed here. There's a couple good questions here that I didn't totally get. I see Felicitas Ramos on Facebook saying, longtime viewer, first time questioner. My son is getting married in early August. Should I be worried about another lockdown or limitations on gatherings? So first, congratulations to your son. I do not foresee another lockdown or limitations on gatherings. I have to put a caveat on that it is always possible that we could have some terrible new variant emerge that behaved in really different ways. Vaccines stopped working, people ended up in the hospital way more than they were, but I do not think that is likely. And we are much, much, much more interested in doing the things that can be done without needing to resort to limitations on gatherings or lockdowns. So You know, I am hopeful certainly that we will have a good spring and summer. I'm feeling quite good. You know, people can be outdoors. There can be things to limit that risk. Even if we were at high, unless there were a total change in viral dynamics or a new variant that was behaving really differently, we do not want to move toward lockdown. We do not want to move toward limited gatherings. I think it's possible we could have a mask requirement, for example, if we were at high. I think it's possible there could be a vaccine requirement for certain high-risk settings if you were going to be, you know, having indoor dining, et cetera. I'm hoping we don't need either of those, frankly. But from a planning perspective, I've been invited to more weddings this summer than I have in years. You know, I'm a little older, so I had all of these invites when I was in my 20s, and they had sort of tailed off a little bit. But now, in my 40s, I got more people getting married in my life this year than, you know, because a lot of people have waited. And I think it is appropriate to be planning those kinds of celebrations. Again, COVID is not going to be gone in August, but we will do what is needed to keep it in control, to keep, we've increased our surveillance, meaning our testing as we've moved into medium, looking for variants, looking for signs of concern. We're continuing to build wastewater, other early warnings, and we want people to have the wedding first and foremost in their mind, not COVID. So I hope that helps, and I wish I had a crystal ball that could 100% tell you what August would look like, but I am planning to go to all of the weddings that I have been invited to this summer, fully vaccinated, potentially testing in advance, and with my vaccine card in hand. So thanks. If we did not get to you today, we will save these questions, and I will try to get to them next Tuesday, because there's a number still that we didn't get to. So. All right. And those of you who are writing in with some of your specific examples about COVID, thank you for those comments. I see them, I read them, and we will address them next Tuesday. So thanks again for your attention, for your continued interest, and all of your continued work to protect Chicago. We will be back next Tuesday at 11 a.m. Please, in the meantime, we're at medium level. Put that mask on, if you're on transit especially, if you're in settings that you're not sure of, and just have a little more caution. Make sure you've got COVID tests at home, use them if you've been exposed, certainly if you have symptoms, and just take a little more care right now so that we don't have to, move to some of these larger mitigations, which nobody wants to have to do. Thanks, see you next Tuesday.